My name is Qutayba, Almerie. I'm one of the bariatric surgeons. I practice in the northwest of England. I work with Phoenix Health, which is a major provider for bariatric interventions and weight loss programs in the UK. And we work now on the Allurion Balloon, and we had very good results with the balloon. What Allurion brought is a simple method to bring the balloon into the stomach and made it like a swallowable balloon that is done in an outpatient setting. Take about 10-15 minutes to be done, and the patient could carry on with their life after the balloon has been inserted. So if we want to describe in simplicity how the balloon is inserted, so this is the balloon. It's a very thin walled, it's wrapped in a case, and it's the size of a large tablet. So what will happen in outpatient setting is the patient will be in control of having the balloon. So they will swallow the balloon. The catheter will help us to measure how far advanced the balloon is. And when we know that it is in the stomach, aided by X-ray, we will inflate the balloon using this catheter. And when it's full, we just take the catheter out, the balloon is in the right position. This is how the balloon looks like eventually when it is in the stomach. It occupies a big space in the stomach and will give the good results that we are after. And what you need at some times is just to go through a very organized program that will help you just push yourself with the weight loss. And it is not only the balloon itself or the duration of the balloon, it's just the additional program that comes with the balloon in terms of resetting how we eat, resetting how we perceive food, and all the support and tips that comes from our dietitians. All these together will give a good push of weight loss for the patients, and they will help to maintain the weight loss on the long run. Most of the patient will lose between 10 and 15% of their weight. The other additional beauty about the Allurion is that you could use sequential balloons. You could use the balloon more than one time, means that even patients who have a relatively more weight to lose, they could rely on that method to drop their weight back down to where they think that they would like to be. We work as a team of bariatric surgeons, specialist bariatric nurses, and dietitian when we look after our Allurion patients. And this is what I feel that Phoenix Health provides that might be different from other providers, is that this sort of like multidisciplinary approach to patients with Allurion Balloon. What we try is that all the time, try to get in touch with our patients and make sure that we are all on board. One of the interesting things with the Allurion is the other adjuncts that come with the balloon. So our patients will have a scale, that's digital scale specifically linked to an app that's developed by Allurion. So patients could track their weight and their body composition. And the other thing that we give our patients, which is provided again by Allurion, is a watch, like a smartwatch, that would help the patient keep motivated because they could see their numbers, they could see the trend of the weight loss happening. And for us, it's a security to look after the patient, making sure that we can identify patients who are not engaging well, not doing well with the balloon. The balloon will give you the fullness feeling, the satiety, and it will help you control your portions. But what comes with the program, which is the dietitian follow-up, our interventions, will help you build new habits of eating and how you perceive food. And that will allow you to carry on with your weight loss journey even once the balloon program finishes at 6 months and give you the habits. And that's what evidence shows, that results at 1 year follow-up following the balloon have shown that a lot of the patients have maintained their weight loss. And that's what we'd like to see for our patients, just like that sort of ongoing maintenance of their weight loss.